looking after your feet and your skin is absolutely important as well. We take for granted our feet, but it is affected a lot by the diabetes. And it's usually the start of a lot of processes resulting in an amputation to your feet. It is usually a place where an ulcer can develop because the blood vessels that nourishes the foot is not functioning that well or not working that well. So if you've got a little ulcer there, it will tend to progress because the germ will enjoy a lot of the sugars in there to live on, and the blood is not flowing to deliver the immune system to kill off those germs. Your feet are likely to sustain some injury because you're not feeling it. The sensation on your feet is gone because the nerve supply to your feet has been damaged by the lack of blood supply to feed these nerves. It is important that you look at your feet, wash it properly, making sure it is dry, making sure that the skin between the toes are dry, and making sure that you apply moisturizers or oil, even the oil that we use in the Pacific. You can use those to make sure that it kept the moistures in it. The shoes that you wear is very important. It must not be too loose or too tight that might cause a friction or rubbing that might cause a blister, which subsequently can cause an ulcer. It is important that those with diabetes and those that they cannot feel that much on their feet should wear shoes every single time, irrespective where you go. A little stone that's slightly sharp, you will not feel it, but in fact, it will cause an injury. Remember, amputation, common cause of it is diabetes, starting with a very small ulcer or a very little blister in your feet that has been developed and spread, resulting in the amputation. It is very important that you look after your feet, follow instruction of those that are specialists in looking after the podiatrists. Cutting nails is very important as well, that you do not cut your nail in such a way that you can develop what we call ingrown toenails. So very, very important that you follow what your podiatrist advises you do.